All right.
Great. Thank you, Adrian. I appreciate that. Good morning, everyone. My name is Catherine Thorson, and I'd like to welcome you to today's virtual discussion, Bringing Lupus Nephritis Out of the Shadows, sponsored by Winn and Aurinia. Before we begin, let me cover a few program details. The program is scheduled to last about 60 minutes. To ensure that you can view all content within this event, please make sure that your event window is maximized. We will have a Q&A session following the presentation and will take as many questions as time allows. You may enter your questions at any time during the presentation by typing them directly into the Q&A box on the bottom of your screen. As you may be aware, Aurinia makes a medication for adults with lupus nephritis. However, today's presentation will not discuss any new medications and will focus on the importance of early detection and appropriate treatment of lupus nephritis. We look forward to sharing information about our medications in the future. Sorry, I just lost something. I apologize for that right there. So at this time, it is my pleasure to introduce you all to today's speaker, Dr. Winn Chatham. Dr. Chatham is a rheumatologist, professor of medicine, and associate division director of clinical services in the Division of Clinical Immunology and Rheumatology, Department of Medicine at the University of Alabama at Birmingham, UAB, and Birmingham, Alabama. He is also a staff physician with the Department of Veterans Affairs Medical Center and UAB Highlands Hospital. Dr. Chatham, you may begin when you are ready.
All right, thank you. Good morning, everyone. What we're going to do over the next 45 minutes or so is just highlight some concepts about lupus nephritis, why it's important, and why early detection and treatment is needed. You all realize and understand that lupus can be a serious chronic disease with many potential complications. Lupus is a disorder where the immune system inappropriately starts generating antibodies and other immune responses against parts of our own body that break down every day. And this abnormal immune response can then generalize to where it can attack healthy cells in the body and really any organ system. Importantly, one of the more common organs to be involved with lupus is the kidney. In terms of all the internal organs that can potentially be involved with lupus, kidneys are probably the most common one. When it affects the kidneys, that's what we refer to as lupus nephritis. Up to 45 to 50% of patients with lupus at any one time during the course of their disease will have some clinical evidence of lupus kidney involvement. This can vary certainly in terms of severity, but it's important to recognize how common the kidneys can be affected by lupus. Lupus nephritis really means that there's inflammation within the kidney. And it's important to understand that when there's inflammation in the kidneys, as well as other organs, when severe episodes of inflammation occur, one residua of the inflammation will be damaged. So the more severe the inflammation is, as well as the longer the inflammation persists without being treated, that increases the amount of damage that can accrue in the involved organ, including the kidney. When the kidneys are damaged over time like this, with recurrent flares of lupus nephritis or with a prolonged severe flare, the consequences of this are that the kidneys will not be able to function properly in terms of their ability to move waste and excess fluid from the body. And the kidneys also will tend to leak large amounts of protein into the urine, which can cause other complications as well. So this can be a serious health problem in that recurrent attacks of lupus nephritis can cause permanent kidney damage, which can eventually lead to kidney failure, requiring dialysis or kidney transplantation. The other thing that's important to realize about lupus nephritis is that patients with lupus that have this are also at increased risk for other organ complications, including cardiovascular disease. This is a concept that we've increasingly recognized and try to impart to patients as well as the physicians that take care of patients with lupus. So who tends to be affected by lupus nephritis is one question that we would like everybody to understand. In terms of the overall prevalence or percentages of patients in the population that have lupus or lupus nephritis, we know that within the United States, at least, there are at least 100,000 people that are currently diagnosed and living with lupus nephritis. And as I said earlier, on average, at any one time, about 1 in 3 patients who are diagnosed with lupus at the time of their lupus diagnosis will also have evidence of lupus nephritis. So when lupus nephritis presents, it tends to occur early in the course of lupus-related illness. And it follows a general concept that we kind of recognize in patients with lupus, is that when patients finally do get diagnosed with lupus, and as all of you know, or may have been your experience, sometimes it can take 5 to 6 years from the time first symptoms begin until patients get diagnosed. And at the time they are diagnosed, 1 in 3 patients may have evidence of lupus nephritis, and those that are going to have lupus nephritis will most likely have it at the time that they're diagnosed. Lupus nephritis tends to occur more commonly in females, simply because lupus is more common in women by a 10-to-1 ratio. But it's important to recognize that males that have lupus are also at increased, can also develop lupus nephritis, and males tend to have more severe lupus nephritis when they get this, and their outcomes are associated with more complications than occur in women with lupus nephritis. The reasons for that are not entirely clear, whether that has to do with the biology of lupus nephritis in males or if it has to do with compliance issues. That's not well understood yet, but we know that a male that has lupus nephritis, we need to follow them carefully because they do tend to have more severe outcomes with this. In the United States, when we've looked at the prevalence of lupus nephritis in different racial and ethnic groups, we know that compared to Caucasian patients, the prevalence of lupus nephritis is about 4 times higher for patients of African descent. It's also somewhat higher in patients who are Caucasian, that are of Hispanic ancestry, as well as it's twice the prevalence among patients who are Native American. The occurrence in Asians is roughly the same as it is in Caucasians. However, the severity of lupus nephritis in Asian patients with lupus tends to be much higher in terms of its severity, comparable to what's seen in patients of African ancestry compared to Caucasians. So what are the early signs and symptoms of lupus nephritis? How do we detect this, and what do we need to be aware of, or what do you as patients with lupus need to be sure you is getting checked periodically to be sure that you're not developing this complication? Some of the symptoms of lupus nephritis are listed here. This can include increased edema or swelling initially in the lower extremities, involving the feet, ankles, or lower legs. This can often be associated with an increase in weight gain that is mostly fluid retention related. Patients with nephritis, because they tend to have difficulty excreting fluids, may notice increased urination, especially at night. So when your body retains a lot of fluid, when you lay down and rest and go to sleep, a lot of that fluid that's accumulated perhaps in more dependent areas of your body, like the legs, tends to get back into the circulation, and your body can sense the need to excrete increased fluid, and it will do that such that your bladder fills up with fluid at night. So having to get up in the middle of the night more frequently to urinate can be a symptom of this. And importantly, the most early manifestation of lupus nephritis is increased protein in the urine. And so how patients can potentially recognize this if they don't get their urine formally tested for protein is that liquids that have lots of protein in them tend to be frothy and bubbly. So they might notice that there's lots of bubbles in the toilet bowl after they urinate, more than would be the case if you did not have a lot of protein in your urine. Now, unfortunately, all of these symptoms I just mentioned to you are really manifestations of lupus nephritis when things are getting fairly advanced. And so we really need to recognize lupus nephritis well before any of these symptoms become apparent to you as a patient. So it's difficult to identify lupus nephritis early by these physical symptoms alone. And a lot of patients can actually have fairly advanced lupus nephritis well before any of these symptoms become apparent to the patient or their physician. So as I said earlier, what we routinely check for in the clinic and for lupus patients is evidence of leakage protein in the urine. There's what's called proteinuria. Another manifestation that can occur early in lupus nephritis is blood cells in the urine. So this is why it's recommended that for patients with lupus, at least every 6 months, a urinalysis should be performed looking for evidence of blood in the urine, because blood or protein in the urine, because these are going to be the earliest manifestations of lupus nephritis. If you're a patient that's in a subset of lupus patients associated with increased risk of lupus nephritis, and this would be if you're of African descent, if you're of Asian descent, or if you're of Hispanic ethnicity, whether you're a Caucasian or African admixture in your genetic background, patients deemed at increased risk for lupus nephritis, we recommend that the urine get checked at 4-month intervals, looking for early protein or blood in the urine. Abnormal electrolyte levels, these are the salt and potassium levels in the blood, can sometimes be abnormal, but again, this is going to be with more advanced disease. Decrease in the glomerular filtration rate, and that just refers to the blood flow to the kidney and how much of the blood is filtered for excess fluid and waste in the body. And this is usually best estimated by what the blood creatinine level is. So estimations of GFR, or the glomerular filtration rate, are pretty much based upon what your blood creatinine level is, your age and your sex and your weight. So there are formulas based on those 4 parameters that can estimate what the glomerular filtration rate is. And normally for most people, that should be somewhere between 80 and 120 milliliters per minute. If it gets under 60, then that is indicating that you very likely do have some impaired kidney function, and it would raise the question as to whether you might have lupus nephritis. But again, we want to diagnose this well before we see decreases in GFR. So it gets back to looking for these early signs of protein or blood in the urine as the earliest manifestations of lupus nephritis. Lupus nephritis can also be associated with increases in blood pressure. So if there's new hypertension that's developing in a patient with lupus, or they come into us with signs of lupus as well as elevated blood pressure, we get very concerned that this may reflect underlying lupus nephritis that has gotten perhaps fairly well advanced. So again, this notion of picking this up early by evidence of protein or blood in the urine is important. If a kidney biopsy is done, which is how we confirm the presence of lupus nephritis, whether it's early or more advanced, this will show evidence of certain types of inflammation as well as possible scarring in the kidney if the nephritis has been there for some time. So these things listed here with the green check marks are what we check in the clinic to look for evidence of early or more advanced levels of lupus nephritis and what some of the complications are. So what are some of these other complications? In addition to the signs and symptoms, as I alluded to earlier, lupus nephritis can be associated with increased blood pressure, scarring in the kidneys, This can be reflected by the increase in the serum creatinine or GFR, as I alluded to earlier. Other complications, as I mentioned at the outset of the talk, can be premature cardiovascular disease. So we know that one of the major reasons patients with lupus have a shortened life expectancy, it's usually due to the premature cardiovascular complications that can develop in lupus. If we pay attention to these other potential cardiac complications by, assessing for lipid problems with elevated cholesterol and aggressively treating hypertension, being sure patients stay on antimalarial therapy with things like hydroxychloroquine, we know those things can mitigate this premature cardiovascular disease that we see in lupus over time. Importantly, we realize now that patients that have lupus nephritis really do have the greatest increased problems with premature cardiovascular complications and cardiovascular related mortality. And this increased risk for cardiovascular disease tends to associate with more advanced degrees of kidney failure and end-stage renal disease. So one of the things we really want to try to prevent in patients with lupus is advanced chronic kidney disease and progression to end-stage renal disease, because a lot, if not the majority, of the premature deaths in patients with lupus that have kidney disease is going to be related to these cardiovascular complications associated with advanced chronic kidney disease. So as shown on the bottom in the box with the exclamation point, catching lupus nephritis early is important because it can help not only prevent irreversible kidney disease, but it can also help prevent other serious complications, including premature cardiovascular disease, which can lead to heart attack, stroke, and earlier than expected death. So what's the journey or road to a diagnosis of lupus nephritis? How can we best do this? How does this get implemented in our day-to-day care of patients with lupus? So routine urine testing is indeed the key to detecting lupus nephritis early. And I think I've tried to hammer that point home during the first few minutes of this talk. Why is it important? Because protein in the urine can be a key indicator of lupus nephritis. How is this usually done? It's usually done in the context of your primary physician or the rheumatologist or kidney specialist you may be seeing, checking this periodically at intervals to catch this early. You can get this done at a doctor's office or lab. One thing we might talk about is for patients we know that are at increased risk for lupus nephritis that may have difficulty getting into the provider's office at the intervals we'd like for you to do this, you can actually order urine dipsticks for home testing at drugstores, just like diabetics check their urine for sugar. You can get urine dipsticks that can check protein as well. So that's probably something we don't take advantage of enough in patients who are at high risk. But the point here being, you do need to get your urine checked regularly if you have lupus, whether you've had nephritis or not. And if you fall into one of these high risk groups that I mentioned earlier, you should probably get this tested at least at 4-month intervals. All right, so who commonly diagnoses lupus nephritis? So this is usually going to be done in the context of urine tests, as well as blood tests, as well as other serologic tests we may follow over time that are checked for and monitored by either the rheumatologist that you see or a nephrologist if you happen to track into their clinics due to problems with your blood pressure or pre-existing chronic kidney disease. But in terms of who initially diagnoses lupus nephritis, more often than not, this is going to be the rheumatologist who's following you for lupus, that sees suspicion or indications of this possibility. And we may refer you in to get a kidney biopsy to confirm this. This can be done by a nephrologist, or increasingly in many areas, these biopsies are now done by interventional radiologists who specialize in doing invasive procedures under ultrasound or CT scan guidance. But the diagnosis is usually going to be confirmed either by a rheumatologist or nephrologist in the context of a kidney biopsy. So the things that we use to help us diagnose lupus nephritis, in addition to the urine tests, are the blood measures of creatinine, which we alluded to earlier, and the kidney biopsy. So how much protein in the urine are we looking for to become suspicious about lupus nephritis? And there's been some outcome studies with definite guidelines that have come out now that indicate that if your urine protein is estimated to be over a half a gram or 0.5 grams daily, this really crosses the threshold for proceeding with getting a kidney biopsy to confirm whether this is due to lupus nephritis or some other cause. So if you're a patient with lupus and the protein in your urine exceeds a half a gram and is not otherwise convincingly explained by some other reason, it's likely that you will be recommended to proceed with a kidney biopsy to confirm the presence or absence of lupus nephritis and get you on appropriate treatment. The other concept about this 0.5 gram threshold is this has actually become a target for treating lupus nephritis. So if you have lupus nephritis and you get on treatment for this, our goal is to treat you sufficiently and aggressively enough such that we can get your urine protein excretion down to less than half a gram a day. So a lot of our targets for treating lupus nephritis now, the main one is to, within 6 to 12 months of your lupus nephritis diagnosis, is to get this protein excretion down from whatever elevated level it is to less than a half a gram a day. So if you presented with 2.5 grams of proteinuria, we will want to get you on treatment. Hopefully by 3 months, get that down by at least 25%. At 6 months, get that down to less than half of what the elevated level is. And certainly by a year, try to get your proteinuria excretion down to less than a half a gram a day. Now, depending upon how early the lupus nephritis is caught, it may be, the longer it may take to reach that target, and we may not ever get the protein excretion less than a half a gram a day if there's already been a lot of scarring in the kidney, which the treatments for active lupus nephritis may not necessarily be able to correct. So the half a gram is a threshold to proceed with diagnostic pathway to confirm whether lupus nephritis is present. And it's also a target for treating lupus nephritis if that's been confirmed and there's been higher amounts of protein in the urine. The estimated GFR test, as we alluded to earlier, is really based on what your serum creatinine level is in the context of your age, how much you weigh, and whether you're male or female. So the upper limits of normal for a serum creatinine for most females, unless they're into bodybuilding and have a lot of muscle mass, most women, serum creatinine normally should be less than 0.7 milligram per deciliter. For males, that number is going to be higher just due to increased average muscle mass, such that the upper limit of normal is somewhere in the range of 1.0 to 1.2. So your GFR number represents how much kidney function you have. The lower the number of the GFR, the less your kidneys are functioning. So the higher your serum creatinine is correlates with lower levels of GFR. So the higher your creatinine is, that's not good. The lower it is, the better in terms of what the estimated glomerular filtration rate is. So if your GFR number is less than 60, this indicates that you are starting to develop significant chronic kidney disease. And a discussion needs to be had about whether this is due to lupus nephritis. And if so, if you're on sufficient treatment to try to keep that number from getting any lower. Kidney biopsies are helpful to confirm lupus nephritis as well as to rule out other causes of proteinuria or chronic kidney disease. Even patients that have well-established lupus, where we suspect lupus nephritis, not the majority of the time, but some of the time when we do a kidney biopsy, we can find evidence that there's perhaps some lupus going on in the kidney because we can see some immune deposits that all lupus patients are going to have. But what we find is that the reason that the GFR is high or the reason they have proteinuria is due to something other than lupus nephritis. And probably the most common entity we see with this is focal glomerulosclerosis, which is usually not due to lupus, but may be an entirely different entity that's not going to require immunosuppressive therapy. So it's important to do the biopsy to rule out other causes of the kidney disease, as well as to confirm the extent to which lupus nephritis is present in the kidney, including the extent of kidney involvement and how much of it's due to active inflammation and how much of it's due to damage from previous flares of lupus nephritis the patient may have had. So not only are kidney biopsies performed in patients presenting to us with lupus and protein in the urine, but patients that we know have had previous lupus nephritis, if they start to develop increasing levels of proteinuria or over what had been their previous post-treatment baseline, or if they're starting to develop increasing serum creatinine levels and decreased GFR, it will help us answer the question as to whether this is due to a recurrence of or worsening of lupus nephritis, or if it's just due to scarring or some other entity. So in some cases, we'll need to repeat a kidney biopsy to help us answer the question as to whether the patient needs further escalation of their immune suppressive therapy, or if that's not really necessary and be putting the patient at increased risk, treating them for something that they don't really have. Okay, so how do we manage lupus nephritis once we know that that's active in a given patient? We know that immune suppressive medications, when used appropriately and aggressively, can help treat lupus nephritis, where we see evidence of active inflammation in the kidney biopsy, or evidence of active inflammation by seeing lots of inflammatory cells and blood in the urine. Corticosteroids we use at the outset of lupus nephritis flares or new onset, simply because they can quickly reduce and control inflammation in the kidneys while we're waiting for the effects of the immunosuppressants we're giving to take effect. So some immunosuppressants may take several weeks before we start to see the clinical benefit from them. But giving high doses of corticosteroids like solumedrol or prednisone work within 24 to 48 hours to quickly reduce and control inflammation. The problem with steroids is that we don't want to leave patients on these very long, because not only do they help quickly reduce and control inflammation, they quickly reduce your ability to fight off infections. And they quickly cause increased fluid retention. So if you have trouble with heart failure, giving you high doses of steroids can be counterproductive to that. If you have diabetes, giving you steroids can quickly render you to have a lot less control of your blood sugar. And doses of steroids can also cause, that are high, can also cause complications in the bones, such as osteonecrosis, as well as exacerbate the tendency for you to lose bone mineral density, leading to osteoporosis. So steroids are good for the short term to quickly get inflammation under control, but because they do have a lot of other metabolic and infectious side effects, we try to quickly get the dose of that down over a matter of a week or two, so that the patients aren't rendered susceptible to some of these undesirable side effects. Blood pressure medications are very important in treating lupus nephritis, because the higher the blood pressure stays, that in itself can cause damage to the kidney. And even if we get all of the inflammation under great control with combinations of immunosuppressants and steroids, if we fail to control the blood pressure, the patient will lose kidney function and end up on dialysis. So it's very important to not only use immunosuppressants and steroids to manage lupus nephritis, but also try to be sure we get the blood pressure under control. And this can be difficult in some patients, and it may require a combination of 3 to 4 medications titrated up to try to get blood pressure under control in the more severe cases or more advanced cases of lupus nephritis. This can be a real challenge. And finally, anti-malarials. When patients are newly diagnosed with lupus, we try to get all patients on these. This can help prevent the development of other organ complications in lupus. And we also know that patients with lupus that are on antimalarials for long periods of time throughout the course of their disease, this definitely can help decrease some of the premature cardiovascular risk that patients with lupus, and particularly lupus nephritis, are prone to develop. So in patients with lupus nephritis, often will find themselves on all 4 types of these medications, perhaps on at least 2 different immunosuppressants, perhaps, and sometimes anywhere from 1 to 4 different blood pressure medications to get their blood pressure under control. All right, so treatment is vital, but it's important that patients be educated about their disease and know how it can affect their body and how the medications that they're taking work. So it's important for patients to work with healthcare providers to be sure they understand the rationale for their treatment, how specific medications work, what their side effects might be, if there's any issues with them accessing the medication. So communicating about these things is very important. So it's good to have a good open line of communication with all of your healthcare providers, not just the rheumatologist, but also with your primary care physician who may be assisting with your blood pressure management or addressing some of these other cardiovascular risk factors, such as having lipid problems with high cholesterol or diabetes management. It's important to be able to access good sources of information. So the Lupus Foundation has good resources on their website, lfa.org. Other important sources online for references that you can review for patient education include WebMD. So if you need additional instructions about where to find these resources, your providers can avail those to you. Diet and exercise are very critical to managing lupus as well as nephritis. So if you have chronic kidney disease, there's certain dietary recommendations that the nephrologist or their ancillary advanced practice practitioners may review with you. Clearly, we know that patients that eat a healthy diet that's low in fat and sugar and salt, their lupus in general tends to do better. And managing the lupus nephritis and attendant blood pressure and fluid issues is also very much facilitated by adhering to a healthy diet. Exercise is important because the more muscle mass you build, it tends to decrease your body fat stores. And we know that patients that have high body mass index tend to have worse outcomes in lupus as well as lupus nephritis. So trying to work on getting the body mass index less than 30, if it's above that, will definitely facilitate how well patients do over the long term. Other healthy living habits, whether it's exercise, following a healthy diet, meditative practices to minimize stress in your life, this can also work in your favor to keeping lupus flares to a minimum and less severe. So to achieve all those goals, as I alluded to earlier, it's important to have good lines of communication about how you're doing and what your challenges are, difficulties with your prescribed regimen by communicating with the rheumatologist that you see, nephrologist that you may have monitoring your chronic kidney disease, your primary care provider to help you manage some of the comorbidities or other problems that can interact with lupus and nephritis. If there's lots of stress in your life or you're having difficulty coping with chronic illness, counseling with clinical psychologists or counselors that have an interest in patients with chronic illness management can be an important part of this. And if you need guidance in terms of your dietary habits, meeting with a dietitian or nutritionist can help you with this as well. So all of these are very essential to your overall management. As you know, with lupus, it can affect any organ system, so you may have interactions with people in dermatology, neurology, and cardiology as well to assist you with any organ complications involving the skin, nervous system, or your heart. Listed here are just some tips for being your best self-advocate. Obviously, we don't want you to miss appointments with us so we can appropriately monitor your disease. So try to keep track of your medical appointments and not miss them. We really find it helpful if patients come into the office with a list of things that they wish to discuss with us, or a list of their symptoms that they're uncertain about that they need to discuss with us. So do not be gun shy about coming into the office with a list of things that you want to address with us, because that makes for a much better encounter with us, because we cover all the bases that are of concern to you, and lets us know of anything that's going on that may be a tip-off as to either a new lupus-related complication or challenges you may have or potential side effects you may be having from your treatment. If you've had outside blood or urine tests done, it's important to have those organized in a folder to review with us when you come in. It's also helpful to have a list of your medications we can review with you to be sure we understand everything else that you're taking for whatever reason. And although we've been somewhat limited in our ability to allow friends or family members to come into the clinic in the context of the COVID pandemic, it's always a good idea to either have a friend or family member come in to take notes for you or help you remember things that may have been said during the encounter, because, when patients are in the office, there's a lot of information coming at you and it's hard to remember everything. So in the context of the pandemic now, we sort of get around this by having another person listen on the cell phone to help you remember things that may have been said or understand things that might have been said during the encounter by a friend or family member who has listened in on the encounter. So certainly providers should not object to this. We don't, and we understand the value of this, of having a friend or family member in with you when that's feasible, or at least listening on the phone. And I have a list of any questions you have. So anything that you want to address, have that written down so you remember to bring it up when you're in the clinic. So these are all good tips for being your best self-advocate. Telemedicine, it's really grown by leaps and bounds over the last 2 years, as everybody I think can appreciate now. But if you have a telehealth appointment, the same principles apply. Just have all these things written down and ready. Having a reliable internet connection or a place where you'll have that will certainly facilitate the encounter. If we're going to do a video visit, have the right clothing on to be able to show us anything that you're concerned about. So we need to be able to look at your hands and your feet, plus any area of the skin where you may have a new rash or something like that. So having something that's on that's easy for us to see these things during a telehealth encounter is ideal. The setting where telehealth does not tend to work is if you're at your place of employment, because it's very difficult to be able to do that, depending upon what your job is, but you may be wearing lots of clothes. Try to set these up at times you're not at work, particularly if you're going to need to show us some things, because you need to be in a private setting when you have the telehealth visits. So these are really best done at home or when you're on a break in a room where you can undress to some extent if needed and have the appropriate privacy. If you're able to get your blood pressure checked before the encounter, or at least have a log of this where you've checked it at home periodically so that you can review that with us. And just to the point on blood pressures, we're a lot more interested in how your blood pressure has been running at home than it is in the office when you come to see us, because more often than not, if you're stressed from having to get to the appointment, stressed from finding a parking space, stressed having to check in on time, all those sorts of things are going to tend to raise your blood pressure. So if you have a log of how your blood pressures are running at home when you're not racing to get to the clinic, we're more interested in that than what your blood pressure is when you've had to go through all those things just to get in our office. So blood pressure logs are very important for monitoring how you're doing over time if you have lupus nephritis. So we really like to see, that home blood pressure log. All right, so we talked a little bit about diet. The important things are eat right for your kidneys if you've got lupus nephritis, so you need to be eating food with less salt and sodium. And this often involves eating more freshly prepared meals. Processed foods tend to be high in salt, whether canned or frozen. You do need to be careful about too much protein as you get more advanced stages of chronic kidney disease. So if your GFR is getting below 40, you need to be careful about excess protein in your diet. Unless your kidney disease has gotten that advanced, then probably protein-rich foods aren't going to be a problem for you. But as you get to more advanced stages of chronic kidney disease, the nephrologists or their dietitians will review with you when you need to be careful about that. But the main thing is just avoiding the excess salt and sodium, because that will tend to exacerbate fluid retention. It will tend to exacerbate and give you problems with blood pressure control. Heart-healthy foods, such as fruits and vegetables, are very important for their antioxidants and to help you manage excess lipid levels. As always, before making any substantial changes to your diet, it's good to review those with your physicians or providers. Adding exercise to your routine is important because it can help strengthen your bones and muscles, as well as minimize your tendency to increase your fat stores. So the best forms of exercise are going to be resistance training. If you've got access to a gym where you can do circuits with the weight machines, that's ideal. Stretching and yoga is good for core muscles, certainly. Swimming is good because it is an aerobic exercise with some resistance as well, where it's not going to put extra stress on your joints. At least try to get a long walk in 3 or 4 days a week. Walking at least will give you some cardio, but you can add some resistance training to that by using some ankle weights when you walk or carrying hand weights when you're walking. Regardless of what combination of these forms of exercise you use, a good rule of thumb is just don't engage in any exercise activity that's making you hurt while you do it. It's allowed to have sore muscles, a day after exercise when you've stepped it up a notch. That's okay, but you just don't want to be doing exercise where it's making you hurt in a specific area when you're doing it. So if you're doing something it's causing you pain while you're doing it, and that's an exercise or machine or whatever that you need to skip and move on to something different. Okay, so just remember, you are your own best advocate when it comes to communication. So ask questions during your doctor's appointment. Common questions to be sure you've got answers to when you've getting near the end of your visit. is to know what the results of your last urine and blood work are, know whether or not you've already got damage to your kidneys and what the extent of that might be, understand how your kidney function is going to be measured, understand how we tell how severe your nephritis might become, what your prognosis is, and how you can, we'll try to give you some heads up in terms of what challenges you might encounter, but just be sure if you do encounter challenges, either with adherence to the prescribed medication for whatever reason, that you discuss that with us. We're not the medication police. We're there to try to give you advice about what you should take, and we're there to help you overcome any challenges you're having to complying or adhering to the medication, whether it's your ability to access the medication for whatever reason, or your ability to tolerate them, or your ability to remember to take them. So all of these things you need to bring up with us so we can help you, optimally adhere to what the prescribed regimen is. It is quite a challenge to be able to take medications regularly every day. Now that I myself am north of 60 and have to start taking some medications regularly, I really have a high appreciation for this. So we understand, we get it. So just be sure you communicate with us about what challenges you may be having. So just to summarize, understand your risk for getting lupus nephritis, realize that it's common, and know if you're in one of those high-risk groups. Be sure you're getting routine urine tests done. If your diagnosis with lupus nephritis, be sure you understand the treatment options in terms of what your particular situation is, and continue your efforts to educate yourself about lupus nephritis. Okay, be glad to take any questions if we have time for that.
Thank you, Dr. Chatham. We really appreciate it, and definitely appreciate your expertise and presentation skills. And as a reminder to everyone, if you have any questions, if you'll just put them in the Q&A box at the bottom of your screen, we'd be happy to ask Dr. Chatham some questions for you. Thanks. So I have a question for you. Can you tell this patient and again, once, this is always talk with your own healthcare provider, but the question is, can you tell me if a patient starts dialysis, should a patient see some improvement with their kidney?
Okay, so what dialysis is, the goals of dialysis is to supplant the impaired kidney function in terms of eliminating excess fluid and the waste that build up in the body that the kidneys normally help people excrete. So dialysis is not going to improve kidney function. It's going to replace the impaired function that the kidneys cannot accomplish. So if you're having fluid buildup, once you start dialysis, it'll make those symptoms better and manifestations better, because it's just doing what the kidneys are no longer able to do. Or if you're uremic, where the waste levels in your blood, and a common measurement for that is going to be what the BUN or blood urea nitrogen is, or the serum creatinine is. So you will see those levels go down a certain amount, reflecting the fact that the dialysis treatments are helping eliminate those waste products that the kidneys can no longer do. But the kidney function itself will not improve with dialysis.
Great, thank you, Dr. Chatham. I believe there was a couple more slides left in the program that we're going to pull up real quick, and it was just to make sure that we close this out correctly for you.
Yeah, I mean, these are just some resources available through the All-In program that Aurinia sponsors. So there's some resources that you can access where you can access these online. The website's written there. So that's another source that you can utilize. And this just explains a little bit about what's in that kit. So if you, again, log in, it will give you access to a number of different things that you can use to enhance your knowledge about lupus nephritis awareness. There's also a Facebook site that you can access, as well as their website.
Great, thank you. Sorry about that. They were just kind of hiding there at the end, but thank you for allowing patients to see those resources that the All In has for patients